And now to a recurring problem exposed by the 7 investigators.
Young people in dire need of serious psychiatric treatment, too often being able to escape from the facility that's supposed to keep them safe.
The latest escape happened just last week, and the troubled young boy was missing for hours.
Tonight, 7 investigator Ross Jones reveals why this keeps happening and what it will take to make it stop.
It happened again.
Northfield 911, where's your emergency?
Less than a month after our investigation revealing a rash of patient escapes from the only state-run psychiatric hospital for children, another patient at Hawthorn Center went missing.
I have a patient who went to U of M, the next door to us, and he ran away from there.
He ran away from the U of M building next to you?
This latest escape happened March 15th when a 17-year-old patient was taken from Hawthorn to the University of Michigan Medical Facility down the road in Northville to receive an X-ray. While there, he was able to break free from 3 Hawthorn staff and went missing for hours. According to police records, the missing patient had an assaultive history. That's not uncommon at Hawthorn. Through no fault of their own, many of the patients there can be dangerous as a result of the serious mental health conditions they struggle with. That's why they come to Hawthorn in the first place.
It's really disturbing, actually.
Mary Ann Huff is president of the Mental Health Association in Michigan. This most recent escape marks at least the 15th Hawthorn patient to go missing since 2020. After our last story, state officials told us the hospital was bringing on more security staff to address escapes.
It does call into question what is actually being done, knowing that there were 3 staff that were present with the individual when they were out in the community.
Staff inside Hawthorn say escapes like this are made possible in part due to understaffing. Last month, there were 91 vacant positions at the hospital with openings for 27 nurses and 37 child care workers. The state tells us it took about 4 hours to find and return the missing patient.
And to think about that person having the ability to escape from or run away from the custody of staff or the hospital, of course, is a huge concern because of the risk that the person could pose to themselves.
Because of severe understaffing, today Hawthorn is only admitting about half the number of patients it is funded to treat. The staff working there today say even with those new security measures, they still need more help to keep patients and themselves safe. I'm Ross Jones, 7 Action News.